you have inadequate blood flow, you are just prolonging your chronic pain. There are two main sources of inadequate blood flow from a biochemical standpoint. The first is low levels of nitric oxide. This is a chemical that your body naturally produces. It's a vasodilator, it expands your blood vessels so that more blood can get through. But over time, our body naturally makes less. And certain things like a sedentary lifestyle, smoking, chronic stress, and diets that are low in vegetables yet high in processed foods can all decrease your nitric oxide levels. Easily to fix all of those, bring your nitric oxide levels right back up, but you can also supplement as well. The cheapest and easiest, probably going to be beetroot juice, but then there's L-arginine and L-citrulline, especially together, create a synergistic effect to increase the levels of nitric oxide in your blood. And then second is anemia. Iron deficiency anemia, obviously a big cause, but that's not the only cause of anemia. When we're talking about anemia, what's so important is the oxygen delivery to your cells. So if you have low red blood cells to begin with, that's just less cells that can deliver oxygen. From a functional standpoint, I'm not talking about the reference ranges on your lab work. Functional levels, women, red blood cells should be between 3.9, 4.5, men 4.4 and 4.9. Those are the sweet spots. Then there is your blood cells are too big. If your red blood cells do not mature fully, they don't shrink enough. Now they're too big, they're harder to get through your small blood vessels. That's less oxygen to your tissues. Men and women, MCV 85 to 92. And then there's hemoglobin. This is what actually holds on to the oxygen in your red blood cell to deliver it to your tissues. If you do not have enough, not enough oxygen. Functionally, females 13.5 to 14.5, men 14 to 15.